Hello, how are you doing today?
Pretty good.
My name's Zach. I'm a student physical therapist at the University of St. Augustine. Could you please tell me your name and date of birth?
Name's Alexander Chris, birthday 11/25/92.
Okay, can I check your wristband? Great. So can you tell me exactly why you're coming in for therapy today?
I'm just having some pain and stiffness in my hand.
Okay. Is it a specific? Is it a specific finger, or is it just the whole hand?
It's kind of diffuse.
Okay. So what I want to do today is I want to, because you're having stiffness and some pain with your hand, I want to go ahead and do some. I want to do treatment with some heat therapy today. So I think because it's your hand, paraffin would be appropriate for you. So basically, the purpose of paraffin is to increase blood flows and cause vasodilation. It's going to reduce some of your pain by getting rid of some of those metabolites and increasing circulation. And it's also going to increase your tissue extensibility, thus increasing your range of motion. So before we get started, I want to explain some of the precautions and contraindications and see if you have any of these things. Some contraindications would be an infection, cancer, peripheral vascular disease, or open wounds. Do you have any of those? Okay. And precautions would be that you're too young or too old, which you're in your 20s, so that should be fine. Impaired circulation and any scar tissue in the area. You can go ahead and inspect the area. Okay, everything looks good. So it doesn't appear that you have any precautions or contraindications. So are you okay if we go ahead and proceed with this?
Yep.
Okay, and before we get started, on a scale of 0 to 10, what would you say your pain level is?
It's like a 4.
Okay, so just a little sore, nothing?
Yeah.
Okay. All right, so I already went ahead and checked out your skin. I'm gonna go ahead and do a quick sensation testing.
Okay.
So what I'm gonna do is I'm gonna touch this to your skin. Feel that there?
Mhm.
So if you could go ahead and close your hand or close your eyes, and then I'm gonna go ahead and touch and say yes when you feel the cotton swab.
Yes. 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 Yes.
Okay, great. So now that we've done the sensation testing, we can go ahead and start with our treatment. So this is called paraffin, which is wax. So what I'm gonna have you do is, before we get started, I want you to go ahead and wash your hands. So if you could go ahead and wash your hands for me, please. While he's washing his hands, I'm going to check the temperature of the wax. And the temperature should be between 113 and 129 degrees. And it looks like it's at exactly 117 degrees, so it falls within that range. So now that we've checked the temperature and you've washed your hands, you've sterilized your hand, so what I'm gonna ask you to do is I want you to dip your hand in and then pull it out. And we're gonna do this 6 times. We're gonna coat it with 6 layers. Pull it back out. Wait a second. And go ahead and dip it again. 2nd layer. And dip it a 3rd time. 3rd layer. Dip it again. 4th layer. Dip it again. 5th layer. And dip it again. And that'll be your last layer, so if you can hold that there for a second, let it dry, and then I'm going to come around, I'm going to wrap this with saran wrap. Okay, now we've got this all wrapped up. I'm going to place this in the glove. Perfect. And then if you want to go ahead and take a seat, you can. So come here, I have a timer set up for you. And we're going to go ahead and do this treatment from anywhere between 15 and 30 minutes. Since this is your first treatment, we're going to go ahead and do 15 minutes today. So actually, I'm going to set this for 5 minutes initially. And we're going to have you do this for 5 minutes. I'm going to come check it out and make sure nothing, it doesn't look abnormal. And go ahead and grab a call bell for you. So if during this time you have any pain or anything feels abnormal, just hit the call bell and I'll be right over for you. So we'll wait 5 minutes. All right, it's been 5 minutes. I'm gonna go ahead and take this off real quick. Okay, everything looks good. Does everything feel okay?
Yep, feels good.
All right, so we're gonna go ahead and put this back on. And then I'm gonna go ahead and reset this for 10 minutes. Okay, so we'll do another 10 minutes of treatment. Okay, looks like the next 10 minutes is up. So how does your hand feel right now?
Good.
So your pain level was a 4 before. What would you say the pain level is now?
0.
Okay, that's great. And go ahead and take this off real quick, and we're gonna check your range of motion. Just see if you can bend your finger a little bit more, flex it. All right, so can you go ahead and flex the hand? Feel like you got a little bit more range of motion there?
Mm-hmm.
Great. Okay, so it looks like the treatment did what it was supposed to do. It helped reduce some of the pain, and it also increased range of motion. All right, so I'm gonna go ahead and grab the DigiFlex, and then we're gonna have you do some exercises, kind of work on that range of motion and work on strengthening.